Now let's move on to the second level of applications. At this level, users can use the application to perform some analytical work on the data. We will be looking at ITION and at the CaseReasoner. The first is an application developed by the University of Athens, and the second is an application developed by Siemens. But in the first instance, let's look at the CaseReasoner. The CaseReasoner is an advanced tool developed by Siemens for Healthy Child. The basic philosophy behind the design of CaseReasoner is to provide clinicians with a flexible and interactive tool to enable operations such as data filtering and similarity search over the 4 clinical centers to provide similarity search-based decision support and also to facilitate the exploration of the resulting sets of clinical records. The aim is to let clinicians explore and compare the patient's records regardless of their geographical location and to visualize their place in the distribution within the whole population of patients. The CaseReasoner was designed to utilize the integrated database that we developed, but it also has a number of other advantages which Martin Huber will now summarize.
This is the basic idea. So we have some validated cases in our database. We have a new case. We look up which cases are similar, and then we look at the outcome of these similar cases. Okay, so what are the advantages? This clearly is a method that relies heavily that we do have this grid, that we have a lot of validated high-quality data at leading centers. It is very generic. The idea just compare to patient records is very generic. So actually we have done this with genetic data, we have done this with imaging data, compared imaging data, similar images, and also with clinical data. All you need basically is you have to define what is similar, what is your distance between 2 patients. And here we offer 2 possibilities. Either the clinician tells us, okay, for me ejection fraction is the most important thing, show me similar patients with regards to ejection fraction. Or we can say, no, the system can learn something. So if we have validated data, we just give the validated data to the system, and the system does the clustering, the classification for us.
As we have already seen, Healthy Child utilizes a number of data visualization tools which, when used in conjunction with the CaseReasoner, make it a powerful tool for clinical knowledge discovery and decision support in various classification contexts by combining the power of machine learning with the transparency of case retrieval and nearest neighbor classification. There are 2 main clinical use cases for the CaseReasoner. One is to support diagnosis. We can examine patients which could be similarly diagnosed and investigate whether they are healthy or if they have some kind of subtype of a disease. The second is treatment selection. From examining similar patients, we can investigate whether they profited from a certain treatment, be it surgery, for example, or chemotherapy. The clinical applications of the CaseReasoner and the other tools we will cover will all be explained in more detail when we shall be telling about the clinical work of Healthy Child. But there are 2 primary use cases which the following example will clarify. When having to diagnose a new patient, a clinician, after inputting the patient's scans and data, can ask the CaseReasoner if there have been similar cases at any of the partner hospitals. The clinicians can cluster the relevant patient using the data visualization tools with those of other hospitals and then examine the data pool to see if the patient belongs to a specific subgroup. If this is the case, the clinicians can then examine how those patients have responded to certain clinical procedures. This process may support the clinician's diagnosis about how to treat their patient.